Welcome to healthU. The latest 2024 research has discovered that taking 4 milligrams of melatonin 3 hours before sleep can significantly improve sleep quality, proving much more effective than the traditional recommendation of taking it 30 minutes before bedtime. This large-scale analysis, encompassing 26 trials with 1,689 observational data points, has completely transformed our understanding of how to use melatonin properly. Do you often find yourself tossing and turning in bed, unable to fall asleep? Or do you wake up frequently during the night and still feel tired in the morning? These sleep problems, which trouble hundreds of millions of people worldwide, now have more scientific solutions. The American Academy of Family Physicians has officially recognized melatonin as a first-line treatment option for insomnia, and the latest research provides precise usage guidelines. To understand why melatonin is so effective, let's first look at how it works in the body. Melatonin is a natural hormone secreted by a small gland called the pineal gland, located deep in the brain. Unlike regular sleeping pills that directly make you drowsy, melatonin works by binding to MT1 and MT2 receptors in the hypothalamic circadian rhythm center and the retina, precisely regulating your sleep-wake cycle. Under normal circumstances, melatonin begins secreting in the evening, reaches peak concentrations at night, usually hitting its highest levels between 3 and 4 a.m., then gradually decreases in the morning. This natural secretion pattern tells your body when to sleep and when to be awake. However, modern life's blue light exposure, irregular schedules, stress, and aging can all disrupt this precise system. A landmark study published in the Journal of Neurology in 2021 analyzed 23 randomized controlled trials, covering 2,642 research papers, with exciting results. The research showed that melatonin supplementation can significantly improve sleep quality in adults, with an average improvement of 1.24 points on the Pittsburgh Sleep Quality Index, PSQI, an internationally recognized sleep assessment standard. While this improvement might sound small, it represents significant progress in the field of sleep medicine. More importantly, the research found that melatonin helps patients with different diseases. For patients with respiratory diseases, sleep quality improved by 2.2 points. Metabolic disorder patients saw improvements of 2.74 points, and primary sleep disorder patients also had improvements of 0.67 points. These data confirm melatonin's broad applicability. Regarding dosage and timing, traditional recommendations suggested taking 2 to 3 milligrams 30 minutes before bedtime, but the latest 2024 dose-response analysis has overturned this notion. This study, including 26 trials and 1,689 observational data points, found that when the dose is increased to 4 milligrams and taken 3 hours before sleep, melatonin's sleep-promoting effects reach their peak. For different age groups, experts recommend varying dosages. Children should start with 0.25 to 0.5 milligrams, with possible weekly increases of 0.5 milligrams. Adults should begin with 1 milligram, with possible weekly increases of 1 milligram. Children weighing under 40 kilograms have a maximum dose of 3 milligrams. Those over 40 kilograms can take up to 5 milligrams, and adults can go up to 10 milligrams. However, most experts still recommend that adults use 1 to 5 milligrams, which is sufficient. Melatonin is particularly suitable for addressing sleep problems related to circadian rhythm disruption. If you frequently work night shifts, experience jet lag from crossing time zones, or have delayed sleep phase disorder, meaning you naturally sleep and wake very late, melatonin can provide excel and help. For children and adolescents with neurodevelopmental disorders like autism or attention deficit hyperactivity disorder, ADHD, melatonin's effects are particularly significant. However, certain populations need to be especially careful or completely avoid using melatonin. Children under 2 years old absolutely cannot use it, as their sleep patterns are still developing. Pregnant and breastfeeding women are also not recommended to use it due to insufficient safety data. People with autoimmune diseases should be cautious, as melatonin might stimulate the immune system. Elderly patients with dementia are also unsuitable, as it might worsen symptoms. If you're taking other medications, you must pay special attention to drug interactions. When melatonin is combined with certain antidepressants, particularly fluvoxamine and other selective serotonin reuptake inhibitors, SSRIs, it can increase melatonin blood concentrations by 2.8 to 12 times, potentially causing excessive sedation. Combining it with anticoagulants like warfarin increases bleeding risk. Elderly people, due to slower metabolism and frequent use of multiple medications, need to be particularly careful when using melatonin to monitor fall risks. Regarding side effects, short-term use of melatonin for 1 to 2 months is relatively safe for most people, but long-term safety data is limited. Common side effects include daytime drowsiness, headaches, dizziness, nausea, and particularly vivid dreams. Some people might experience depression symptoms or worsening mood disorders, in which case they should immediately stop using it. Compared to prescription sleeping pills, melatonin has clear advantages. Benzodiazepines and Z-drugs, while fast-acting, easily cause dependency, withdrawal symptoms, and next-day hangover effects. Melatonin doesn't have these problems. It primarily regulates your biological clock, rather than forcibly making you drowsy. While its effects are gentler, the side effect risks are also relatively lower, and it doesn't produce tolerance, meaning long-term use doesn't lead to diminishing effects. However, you need to be particularly careful when purchasing melatonin products. A 2023 study examined melatonin gummy products on the market and found that 88% of products had actual content that didn't match their labels, ranging from 74% to 347%. This inconsistent quality not only affects effectiveness, but can also cause unnecessary side effects. It's recommended to choose products from reputable manufacturers with third-party testing certification. In summary, melatonin is a relatively safe and effective natural sleep aid, particularly suitable for addressing sleep problems caused by lifestyle changes or circadian rhythm disruption. The latest research suggests we should rethink usage methods. 4 milligrams taken 3 hours before sleep might be more effective than traditional recommendations. However, everyone's situation is different, so it's best to use it under medical guidance and pay attention to individual differences and potential drug interactions. If you have persistent sleep problems, remember to first seek professional medical advice to identify the root cause. Melatonin is just one tool for improving sleep quality. Combined with good sleep hygiene habits, it can achieve optimal results.